So this is a, I don't know, 9-day-old infant who was home, born by C-section at 38 weeks. Mom had previous C-section, so that's why she had the C-section, was discharged at day 3 with mom, has been home eating, wetting diapers, taking naps, and doing normal baby stuff. And mom got a phone call that she needed to call her pediatrician. She did, and the pediatrician said, your newborn screen just came back as abnormal. I want you to go to the emergency room. They showed up in the emergency room. They were told that the congenital adrenal hyperplasia screen was positive, and the ER has drawn some labs that you see here on the cow, but they haven't really done anything else, and they sent the baby up to us.
Yeah, so do we have IV access?
You do, you have
yep,
two
there's
IVs.
one IV in there. There's two.
One in the
Yeah,
foot
there's one in
and
his
one in
foot
the
and
arm.
one in his arm. Mm-hmm.
Okay, so immediate thing I would like to do is, I don't know dosing, but calcium gluconate to protect the heart.
Okay.
With the K of that high, and then I forget, what do we use for like first step? Insulin. Do we use insulin or albuterol? I think insulin first, right?
All right. You said calcium gluconate's been given.
Yeah, so we'd like to give insulin also for to help pump some potassium out of the bloodstream into the cells.
Okay. All right. I'm giving insulin now. How much insulin did you want to give?
I'm not sure. We would give dextrose with that because the sugar was 130. I don't really know the dosing corrections for like what we did.
So you guys want insulin, or you want dextrose, or what do you want?
Both.
Is there one before the other? I have both.
It would be both. We would hook them up to dextrose fluids and give insulin. I'm not sure if we would bolus him with the dextrose in conjunction.
You don't want to give the dextrose first.
You would give dextrose first?
First. Just think about this.
So do you guys want a bolus of dextrose, or you want an infusion of dextrose, or what do you want?
I have.
You can bolus, right?
Yeah,
Yeah, bolus.
Yeah, I guess we'll do like 5 per kilo D10 bolus.
D10. Okay.
Give
All
him
right.
insulin and then hook him up to D10 fluids given his age.
Okay. So I have a 5 per kilo of D10 bolus here. I'm gonna give that now.
Then it would be 0.1 mg per kg of insulin.
Okay. Great. Okay.
Units.
All right. Then I'm gonna give him an insulin dose. Okay.
You guys already gave calcium.
Yeah.
We didn't get bicarb yet. We
All
got
right.
stuck on the dosing of insulin for 20 minutes.
The insulin is in.
And then does anyone know dosing of sodium bicarb?
Let's see here. 1 to 2 milliequivalents per kilogram dose.
So 1 milliequivalent per kilogram.
Yeah.
1 milliequivalent per kilogram of sodium bicarb.
Okay.
He's
All right,
now
I'm
also, can you check and see if the patient has a pulse for me, please?
The patient. No, I don't feel a pulse.
Okay, so
VTAC.
yeah, he's in VTAC, so we do chest compressions, these
Yeah,
pulses.
Put
Yes.
that pad, sir.
Yeah, get pad, start chest compressions. So Anurada, if you could start compressions, please, initially, or whoever's first. That's great. Thank you, Dr. Slater.
Doing compressions, and I'll put the pads on.
Okay. And then is this an unsynced or a sync?
This would be like.
Unsynced, right?
But you guys want me to get the defibrillator? I'll go get it really quick.
Yeah,
It's right out
defibrillator,
here.
please. And then Dr. Slayman, is the patient breathing on their own currently? No?
Does not seem to be breathing.
Is there anybody else in the room that could help bag?
All right,
You're
the
gonna be doing-
defibrillator's here.
Perfect. Whoever can help, if they're not and you're doing one person CPR, do 30 to 2 for your compressions and breaths.
Okay. The defibrillator's here, so what do you want me to press on it? Is the sync
How
again?
much, do we know how much the kid weighs? I forget. It would be 2 joules.
He weighs 4 kilos.
So it would be 8 joules.
Okay, so you want me to press the sync button again?
No, we'll keep it. This will be an unsynced defib, so
Okay.
we just charge.
All right, so 8 joules is on, so I'm gonna press charge.
Yep.
All right, so we're charging. All right, everybody hands off the patient, okay? And we're gonna shock. Shock delivered.
Resume compressions. I forgot. What will be the next step?
What do you guys want to do next?
Give that beat.
Epi? Okay,
You
Anurada,
wanna
you have
get
some
epi?
epi?
Yep, I got some epi, okay. All
You
right,
guys
I'm
know how
giving,
much?
You just switch it.
You can't, right?
Can't Hyperkalemia. We can do it.
Yeah, I'm not.
All right.
I don't know the
Did you
dosing
guys
of it.
figure out your dose of epi? I'm sorry.
I know
So,
one. Next
0.01,
Yeah, 0.01.
0.01 per kg, so it's what, 4?
Yeah, he was 4 kilos, so what, 4?
0.04 makes
So is that
Okay.
0.4 milliliters?
It's time for a pulse check.
check.
Okay. Check, pulse
Okay,
check,
we can
please.
pause.
I would have went and got my pals card.
I do not
It's so
feel any
frustrating.
pulses. We had pulses with compressions, but they seem to be gone.
Okay, we're due for another shock too at this point.
Okay.
So do you want me to give the epi or give the shock?
Both. I mean, we can hold
Okay.
off the epi. The shock's more important right now. Whatever.
Okay,
I
okay.
thought you already gave it.
Okay. No, because I didn't hear the
so
dose. Sorry. Okay,
This would be 4 joules per kilogram, so this would be 16 joules.
All right, so it's charged, hands off. Shock delivered.
Is that calcium gluconate or
I think
calcium?
it's calcium chloride, 10%.
Use that.
Okay,
Oh, it's time for a pulse check.
pulse check, please.
Okay. We'll do a pulse check. Compressions hold. Okay, I feel a pulse.
Okay, we can stop compressions. Are we spontaneously breathing?
Can I feel a pulse? Yep, we are.
Okay. How does the patient look to you?
He looks a little better. He's not blue anymore. He's definitely picking up a little bit. He's still kind of out of it, but he's definitely picking up a little bit.
Okay, I mean, I
He's
would like
crying.
to, if we're not done, I'd like to check another sugar, blood gas, see his acidotic state and blood glucose
Okay, sure.
and
Cool.
his K and everything.
Okay,
Why
great.
don't we pause there, Anurada?
Yep. Good job, Matt.
What was
So-
your thought process?
So this kid came in, he was not true, like not fully, but he was at risk for adrenal crisis. He did have hyper K, but his sodium was fine, his glucose was fine. And I forget his exact pH, but I don't think he was that acidotic. But he was a little lethargic and breathing fast, probably from some acidosis. We
Before
saw
we,
on the monitor.
Matt, before you go too far into the guts of the case, tell me more about adrenal crisis. Like, what do you mean by that? What is this CAH diagnosis mean? Where'd it come from? What are we talking about?
So the most common in this age range that would get picked up on the newborn screen is 21 hydroxylase deficiency.
Yep, absolutely.
So they do not produce mineralocorticoids or cortico.
Deficiency. The enzyme is deficient. You can't make cortisol. Cortisol is necessary for stress response, necessary for salt metabolism. So they are hyponatremic and hyperkalemic. But all the other functions of the adrenal gland are unblocked, and they're overstimulated because the feedback loop is saying, you need more steroid, you need more steroid. So absolutely right, 21 hydroxylase is one of many enzymes, but it's the most common one. So what was the immediate thing that you were trying to deal with, Matt, that you were worried about? You said, all right, well, we got a lab, and this lab is abnormal. I got to do something about it.
The potassium of 8 something.
Yep, and you asked about an EKG because why? What was that going to tell you?
There's varying degrees of EKG changes based on hyper K and how severe and acute it is. And so peak to T waves, and then I forget the order, but you get an increased QRS, and then the P wave flattens over time, and
And you progress.
you get a
into
wider
sine wave.
QRS complex. All right.
You and your team quickly identified the things to try to prevent this and get the K down. Let's go through what your suggestions were to bring the K down. What drugs, what maneuvers were you trying to give?
So we initially did calcium gluconate for myocyte stabilization.
Yep.
But that does nothing for the K itself. And then we were doing temporizing measures with insulin to try to push K into the cell from the intravascular space. And
Great.
we
You did a lot of that with, is this guy breathing? All right, well, Dr. Slayman, can you start bagging? And you were able to see me come into the frame and start bagging. So remembering and kind of practicing that closed loop communication, even in this virtual reality setting, is definitely something that's important to us and will make you guys better teammates and better code leaders when you're doing this at the bedside in real life.
Thank you. This was great.
That was actually.
All right, guys.
I like
Thank
this.
you so much.
That's very sweet.
Thank you.
Great.
Yeah.
Thanks guys so much. Great job.